What causes false positives in CF newborn screening results? Imagine a tiny baby just a few days old getting a screening test that suggests they might have cystic fibrosis. But sometimes, that initial result isn't accurate. It's important to understand what can cause these false alarms. First, the screening process usually involves two steps. The first measures a protein called immunoreactive trypsinogen, or IRT, which is made by the pancreas. Babies with cystic fibrosis often have higher levels of IRT. But elevated IRT can also happen for other reasons, like stress during birth or other illnesses, which can lead to a false positive. So, high IRT doesn't always mean the baby has cystic fibrosis. Next, if the IRT level is high, a second test looks for common genetic mutations linked to cystic fibrosis. However, this genetic test often detects carriers, babies who have one mutated gene but do not have the disease. Since carriers do not develop cystic fibrosis, this can cause a false positive result. In fact, about 90% of false positives happen because the test finds a carrier status rather than the disease itself. Another factor is that genetic testing panels often only include the most common mutations. There are many different mutations that can cause cystic fibrosis, and some are rare or not included in standard panels. This can lead to ambiguous or uncertain results, which may be mistaken as positive. Other biological factors can also influence the results. Premature birth, low birth weight, or other neonatal health issues can elevate IRT levels temporarily, which may trigger a false positive. Additionally, differences in how labs handle and process samples, or variations in testing techniques, can affect accuracy and sometimes lead to incorrect results. It's crucial to remember that an abnormal screening result does not mean the baby definitely has cystic fibrosis. Confirming the diagnosis requires a sweat chloride test, which measures the salt in the sweat. This test is considered the gold standard for diagnosing cystic fibrosis. Most babies with a positive initial screen but normal sweat test results are actually carriers, not affected by the disease. They can benefit from genetic counseling to understand what their results mean for their family. In summary, false positives in cystic fibrosis newborn screening mainly happen because of elevated IRT levels caused by other factors, detection of carrier status through genetic testing, and limitations in the testing methods. Always follow up with a healthcare professional for proper diagnosis and guidance. Remember, screening is a helpful tool, but it's not a final diagnosis.